Hello, I'm Carrie Ann DeCindis with Eyecare Business, and I am thrilled to be here today with Jim McGrann, President and CEO of Advancing Eyecare, and Jeff Todd, President and CEO of Prevent Blindness, to discuss Jim's Person of Vision Award honor. Thank you both for joining me.
Oh, it's great to be here. Thanks for having me.
Yeah, happy to be here.
So, Jim, congratulations on receiving this honor. There's so much to celebrate at the upcoming Vision Expo, which is celebrating 4 decades, as is Eyecare Business. Under this theme of reflection and celebration, and as you reflect on your time in the business and in the vision sector yourself, how has that journey really shaped your view of where the industry is today? And what does this recognition mean to you, both personally and professionally?
Sure. Well, thank you very much. Well, first, I'd say congratulations to Eyecare Business on their 40th anniversary. That's no easy feat in the world today. And I have to say, the recognition for me, I'd describe it as a bit overwhelming. I'm truly honored and humbled by it. When I look at the list of the previous winners, the list is made up of people that have been mentors, partners, and friends of mine for the last 27 years. So being a part of that group really does blow me away. As far as the journey, my journey, I've had the privilege to work at some real amazing companies in the industry: Marchand Eyewear, Eyefinity, VSP Vision Care, VSP Global, which is now VSP Vision, Healthy Eyes Advantage, and PECA, and now I'm at Advancing Eyecare. So I've been able to see and experience the industry from a lot of different directions, and then also added to that, being privileged to be on the board of Prevent Blindness and on the board of the Vision Council and at NVI. I really get to learn a lot about the industry, the frame side, the software side, managed vision care, labs and lenses, retail, buying in alliance groups, and ophthalmic equipment now. And I'd say my view of the industry right now is I'm really bullish on the state of the industry. There's enormous tailwinds. We have an aging population, higher incidence of eye diseases like diabetic retinopathy and AMD. We have a shortage of ophthalmologists in the supply chain here, and OD's scope of practice is starting to expand. So I think it's a great time to be a part of the industry, and I think we'll talk a little bit later about the need that's out there and how we can all come together. But really excited to be here, and honestly very honored and humbled by the award.
Awesome. We're all looking forward to celebrating you at Vision Expo, and there is a lot to celebrate. And I agree, there's a lot changing in the industry. So Jeff, I will just punt this over to you. Receiving this recognition from a public health-focused organization speaks to a broader impact. And I'm just curious, how has Jim's leadership, resonated across the industry and advocacy circles, and what does that mean for eye care professionals that are navigating today's vision landscape?
Absolutely, yeah. As Jim mentioned, he's been on our board. He just rotated off our board, although he's now an emeritus member for 6 years, and the last 3 of those were as board chair. So I was able, and the staff and all of our board, to work very closely with him over the last many years. And I think his impact has really been enormous in a number of spaces, but the biggest one from my perspective is helping us reintroduce ourselves to the optical industry. Prevent Blindness has changed a lot over the last couple decades, and Jim's presence has helped me and our team understand a little bit more about the optical industry, introduced us to important people and efforts in that realm. And frankly, the Person of Vision dinner has grown enormously under Jim's leadership, as has our organization. We can talk a little more later about what Prevent Blindness is up to, but we've grown significantly under Jim's leadership and couldn't be more thankful. So when his name came up as a possible honoree, it was a no-brainer for us and the committee.
That's awesome. Yeah, we'll circle back to what this means for the gala at Vision Expo. But Jim, both Advancing Eyecare and Prevent Blindness play these important roles in shaping where vision is headed. And looking ahead, how do you see partnerships between these type of industry groups and nonprofits and practices helping, expand access, improve equity, and drive innovation in eye health, because I think that is a really important message for our audience to hear.
For sure. Yeah. I mean, a really important thing to remember, and this is something that I'm stealing from my good friend, Dr. Susie Yu from Kaiser, but eye care is healthcare. And when we think about the number of individuals that end up going in and seeing their optometrists annually, or at least, every 18 months versus going to see their regular practitioner, it's so important. It's such an important part of the overall healthcare continuum. So when you look at the globe today, but in America as well, there's about 1 billion people in low and middle income areas of our country and around the world that live with avoidable vision impairment. And what the message we're trying to get out through Prevent Blindness and other groups that Jeff has helped coordinate with, working with the IAPB and the World Health Organization, is this challenge represents about 15% of the people on the planet. I mean, it's a huge number, and the majority of those issues can be solved with very, very simple, proven interactions that we have today: glasses, basic diagnostics, and access, as you mentioned, to eye care services. So the other thing to think about with everyone's business hat on is that this is not only a humanitarian issue that we're talking about. It's one of the highest return on investments in both global health and in philanthropy. So just quick stats: every dollar that gets invested in vision and eye health yields $28 in economic return. So if we're able to address the avoidable vision loss problem around the globe, and starting here, focusing in America, we could unlock almost 450 billion, half a trillion in global economic global economic gains. So it's beyond. There's a humanitarian effort, absolutely, and want to take care of the people. But really, what's not changed, the science hasn't changed at all. It's really about what you said, bringing these groups together. It's this convergence of policy, of capital, and execution capacity that now makes large-scale market creation possible. So we're going to be able, together, through the work that Jeff and his team have done, pulling industry, government, GPO, all these organizations around the world into a very highly functioning, focused group on solving this problem. And I think we can solve it in our lifetime.
Well, thank you. Yeah, of course, our audience, we tend to see things from that business outlook. So I'm really glad that you did touch on that as well. And I think, Jeff, you could probably speak on to, as Prevent Blindness prepares to celebrate at the upcoming gala, how will these funds specifically, support these types of efforts, and what key initiatives are at top of the Prevent Blindness agenda for the year?
Yeah, first of all, this is our largest event, our largest fundraising event every year. And so we're so appreciative of the dollars that are raised here from everyone who shows up to celebrate the optical industry and our persons of vision each year, and Jim this year. But what we're doing, the coming year has so much going on at Prevent Blindness. We're in the midst of trying to pass a law in Congress that would allow for funding for states to implement children's vision programs. We're about to launch a new awareness campaign to help more and more people understand the resources that we have available. We have a Diabetes in the Eye program that's in its early stages that is really helping people with diabetes understand the importance of caring for their eyes and helping get access to that care. We have a glaucoma community that is helping people with glaucoma connect with one another. And our Aspect Patient Engagement program is another program that really helps us connect patients to one another, but also to industry. We're a patient advocacy organization, and that means that we work with patients to advance education, advocacy. All of our work is done in collaboration. And then finally, and as Jim alluded to, while we are primarily a U.S.-based organization with the U.S. focus on policy issues, we are involved in the global eye health community. And, this is a small world and we all have to be in it together to solve the problems. There's going to be a global eye health summit in November. The Prevent Blindness is proud to be a sponsor of, and we're going to be contributing to that as well. So it's going to be a big year for us.
Awesome. You're not busy at all, it sounds like.
Not at all.
Awesome. Well, I look forward to celebrating all of those initiatives at Vision Expo, and I know a lot of our audiences as well. Just to close this out, I think a lot of us have our, future crystal ball caps on. I like to ask you both, as we look ahead more broadly, what topics or trends are you seeing in the vision industry, and what would be your advice for our audience of eye care professionals on how they can prepare to navigate this future in vision care? I'll let whichever one of you wants to go first.
So for me, and I think obviously you can't turn on the TV or read a magazine or read a paper and not talk about AI, right? And at times it can really feel overwhelming. And I think for practitioners especially, they are constantly drinking from a fire hose, right? All of us in the industry want to help and want to be there for them, but I think we fire hose them a bit, right? So I think the key with AI adoption is, one, I'm a firm believer in AI is not going to replace doctors, but doctors that leverage AI and use AI will replace doctors that don't. So they do need to adopt it. I believe there's a sense of urgency, but they need to do it in phases, right? The whole concept of don't try to swallow the elephant, right? Get a strong partner or partners that can help you walk through the technology integration. I think what we're seeing is, because the population, the patients that show up in an office every day are much more technologically savvy because they're on their phones or on their computers all day. When they go to a doctor's office, they expect to see technology integration. They expect to see it working together. They don't like to see a lot of paper and things flying around there. So, and you see it in comments that patients make about offices. And a lot of that is going to be how they're going to be able to do this efficiently and effectively is by leveraging AI. So I think don't be afraid of it. Take it in phases and really embrace it, because it's going to help make the profession stronger and help make our industry stronger. It just has to be done right.
For sure.
Well, Jim pretty much stole my thunder here. I certainly was going to mention AI. As he said, we can't go without doing that. And he also mentioned earlier what is termed as oculomics. I think I'm saying that right. Which is really this emerging field of how the eye can reveal information about systemic health. But I think, I would just wrap it up by saying all these wonderful technology advances, everything that is coming down the pike is wonderful. But we always have to come back to the patient. It's about the patient. And every single one of us, if we live long enough, we're going to have some sort of an eye health need, whether that's just a pair of glasses, whether that's significant vision loss. And so whether it's the optical industry, the pharma industry, the patient advocacy groups, we all have to remember it's about the patient. Mm-hmm.
I think that's awesome. And it's nice to have a little bit of an optimistic outlook to it all, because sometimes it can be a little bit doom and gloom with AI and all of this technology. But I do agree that there are ways to adapt and to, look forward without it feeling like that fire hose concept of how can we take this all on right now. So thank you both very much. And I look forward to celebrating you, Jim, at the gala, and we will speak to you all soon. So thank you both for your time, and we appreciate it.
Thank you very much. Thank you.